The dogmas of the quiet past are inadequate to the stormy present. The occasion is piled high with difficulty, and we must rise with the occasion. As our case is new, so must we think anew and act anew. We must disenthrall ourselves, and then we shall save our country. Abraham Lincoln. And I don't know how many of you came away from that week feeling hopeful, feeling emboldened that we need to all be out doing something, and also extreme urgency. So those are some of the things. So I really do think that some of the work we're doing here, many of you are doing this outside of your job descriptions. You really are being called. So we're called upon to transcend and transform the current system. And no collaborative escapes from Deming's quote, "Every system is perfectly designed to get the results it gets." What is the system we have right now? We are state employees that have some of the best benefit packages around, preventive, et cetera, et cetera. Yet, with our health screenings outcomes and some of the state indicators, we know that our workforce is not really that healthy. So better benefits or different benefits are probably not going to resolve the poor outcomes that we're seeing. So I love that word. We need to disenthrall ourselves from the current system and beliefs that go with it. We need to transcend the system where the focus is on health care and what the health plan pays for, and really a system that doesn't pay attention to you until you're sick, until you have a diagnosed disease. So we need to transform how health, not just health care, is supported in this country. So this is really about what we're doing in our circle of influence, but it really is for our country. One of the effective ways to do this with potentially large gains is in the work at the Worksite, as we're finding out. So the work you're doing to reinvent your agency and how your agency integrates supporting employee health into the business practices of the agency is really important. And I am really thrilled to be a part of it with all of you. So thank you for your work. The good news. We need to change the system. And there's some darkness, but there's a lot of gray and there's a lot of light, because we know that in the private sector, companies before us have been able to improve the health of their employees and affect the bottom line. So we will be hearing more about this from two of our guest speakers, Dr. Jeffrey Harris from the University of Washington this morning, and Jeremy Citro from the Benefits Roundtable this afternoon. Peter Senge, who's a leadership guru from the late 90s, and I think he was just through here with some of the management teams for state agencies, talks about transforming a system, but having new tools to do that. You can't use the old tools to transform the system. It won't help you think outside of the box. So we introduced some new change tools, and you all have just done a great job trying to learn how to use them and make the changes at the same time. We have a change package. That's our guide. That's the high-level guide that we'll always have on the wall. You never reach it. It's, you have to excuse the religious analogy here, but it's a little like the Ten Commandments. They're always there. They're just the guide. It's just the guide. The Healthy Worksite Collaborative that we're all a part of through June is a learning model that subscribes to sharing failures and sharing successes, and also a commitment that all of us will be successful. So we are all here to make every agency in this collaborative successful. And the third thing about the learning model that I really love is it respects people for where they are, and it respects people for the knowledge they have. Because every single person in your agency knows something about what they're doing that will help change the system. And then the third tool is a model for improvement, and I also love this one because I like to move fast. And this is a tool that allows us to test in rapid cycle changes so that we're not sitting around a table planning for months and months. Sometimes we get burned, sometimes we make mistakes, but all in all, I think it really does catapult us ahead much faster. One other tool that I didn't put up here that's really kind of incorporated is the population-based management that you're all learning so well. And that is taking a look at what the picture of your workforce looks like with the health surveys and health risk assessments. What percentage of your workforce is not being physically active? And how are you going to address that at more of an organizational level? That's a hard concept to grasp. We're actually still working on that in our own agency with the health plan benefits. So that is just another really good tool. So what's next? There are two things that in the Institution for Healthcare Improvements Breakthrough Series, they talk about sustaining the gains. So what gains have you made that you want to keep? And then spreading the changes. And who else needs to know about what you're doing in your agency? Sustaining the gains is more about integrating what you're doing into the agency's business. And we're going to do a whole lot more of this afternoon in discussion groups. I'm going to give you an example of what Washington Wellness is doing to sustain the gains. One of the gains we've made is having this change package and this guide put together. There may be tweaks because we need to get the input from you all in lessons learned, but we do have this change package. And what we're going to do is put that into our business model in such a way that it will become a designation program. So we'll use the change package as criteria for a designation program, and that is really how we will operate. We'll be able to put all of our operations and services around this designation program. So that's an example of sustaining gains. Spread is the process of taking something that's working and absolutely replicating it somewhere else, either in the organization, maybe it's a segment of the population, maybe you have some geographical areas that haven't really been touched yet, maybe it's women, maybe it's men, so it's just taking something and taking that change and replicating it there. What we're doing, an example of that is we have the change package, we'll have the designation project. So, I forgot to call CC. Oh no. Somebody's supposed to be on the line, so we'll get them on the line in a minute. Too many details. So, what we're spreading is the change package. How will we do that? If we have a designation project where the criteria for agencies and higher education institutions are to become healthy work cultures, we'll use the designation project to spread the change package. And we may also do it in another collaborative. So I'm just going to end with a Charles Darwin quote. It's not the strongest of the species that survive, nor the most intelligent, but the one most responsive to change. And I think the good news is we can do this. We really can.